Canada's healthcare system is a universal, publicly funded system that provides access to medically necessary hospital and physician services for all Canadian citizens and permanent residents. Funding system is financed through general revenue from federal, provincial, and territorial taxes. Provinces may also charge a health premium, but non-payment cannot limit access to medically necessary services. Organization: Canadian Constitution divides roles and responsibilities between the federal, provincial, and territorial governments. The provinces and territories are responsible for delivering health services, while the federal government sets national standards and provides funding support. Insurance: Each province and territory has its own health insurance plan, but they share common features and basic standards defined by the Canada Health Act. The Act prohibits patient charges for insured health services. Access: Once you're added to your province or territory's health system, you'll receive a health card. You can show this card at hospitals or medical clinics to get non-emergency services. Service: System covers medically necessary hospital, physician, and certain surgical dental services. However, there are some differences between each plan, and coverage for long-term care and social supports varies across jurisdictions. Wait times for elective or non-life-threatening specialist care can be lengthy in Canada. In 2022, the average wait time from referral to specialist treatment was 27.4 weeks.
About Medicare. Medicare is a term that refers to Canada's publicly funded health care system. Instead of having a single national plan, we have 13 provincial and territorial health care insurance plans. Under this system, all Canadian residents have reasonable access to medically necessary hospital and physician services without paying out of pocket. Roles and responsibilities for health care services are shared between provincial and territorial governments and the federal government. The provincial and territorial governments are responsible for the management, organization, and delivery of health care services for their residents. The federal government is responsible for setting and administering national standards for the health care system through the Canada Health Act, providing funding support for provincial and territorial health care services, supporting the delivery for health care services to specific groups, providing other health-related functions. Canada Health Act. Provincial and territorial health care insurance plans must meet the standards described in the Canada Health Act. This is necessary to get their full payment under the Canada Health Transfer. These standards include public administration, comprehensiveness, universality, portability, accessibility, public administration. The provincial and territorial plans must be administered and operated on a non-profit basis by a public authority. Comprehensiveness. The provincial and territorial plans must ensure all medically necessary services provided by hospitals, physicians, dentists when the service must be performed in a hospital. Medically necessary services are not defined in the Canada Health Act. The provincial and territorial health care insurance plans consult with their respective physician colleges or groups. Together, they decide which services are medically necessary for health care insurance purposes. If a service is considered medically necessary, the full cost must be covered by the public health care insurance plan.
Universality. Provincial and territorial plans must cover all residents. Portability. Provincial and territorial plans must cover all residents when they travel within Canada. Limited coverage is also required for travel outside the country. When a resident moves to another province, they can continue to use their original health care insurance card for 3 months. This gives them enough time to register for the new plan and receive their new health insurance card. Accessibility. Provincial and territorial plans must provide all residents reasonable access to medically necessary services. Access must be based on medical need and not the ability to pay. Federal funding for health care. The federal government provides health care funding to the provinces and territories through the Canada Health Transfer. Provinces and territories receive additional federal funding support through other fiscal transfers. Delivering healthcare services to specific groups provide certain direct healthcare services to some population groups, including First Nations people living on Reserve Inuit, serving members of the Canadian Forces eligible veterans inmates in federal penitentiaries. Groups of refugee claimants. Other federal health-related functions were responsible for the regulation of products, such as food consumer products, pharmaceutics devices, radiation-emitting devices like Chelfinish. Federal government also supports health research, health promotion and protection, disease monitoring and prevention. The government also provides tax support for health-related costs, tax credits for disability medical expenses, carriers and disabled dependents, tax rebates to public institutions for health services, deductions for private health insurance, premiums for the self-employed. Accessing healthcare services. Canadians most often turn to primary healthcare services as their first point of contact with the healthcare system. In general, primary healthcare delivers first contact healthcare services, coordinates patients' healthcare services to support continuity of care, which means receiving high-quality care from diagnosis to recovery of movement across the healthcare system when more specialized services are needed from specialists or in hospitals. Provinces and territories also provide supplemental coverage to certain groups of people, such as senior children's assistance recipients. This helps pay for healthcare services that are not generally covered under the publicly funded healthcare system. These services include vision care, dental care, prescription drugs, ambulance services, independent living, home care. Those who do not qualify for supplementary benefits under government plans pay for TE services through out-of-pocket payments, private health insurance plans. Thanks for watching. Never forget to hit the like button and subscribe.